Hello everyone, now let us discuss about 2023 CPT coding guidelines for general ophthalmological services. This comes under the ophthalmology subdivision of medicine chapter. Coming to the definition, now coming to intermediate ophthalmological services. It describes an evaluation of a new or existing condition complicated with a new diagnostic or management problem, not necessarily relating to the primary diagnosis, including the history, general medical observation, external ocular and adnexal examination, and other diagnostic procedures as indicated. And whenever performed, intermediate ophthalmoscopic services may include the use of mydriasis for ophthalmoscopy. Let us see the examples or scenarios where we can code intermediate ophthalmological services. If the patient is suffering from an acute complicated condition, for example, iritis, the review of history, external examination, ophthalmoscopy and biomicroscopy for an acute complicated condition, it does not require a comprehensive ophthalmological service. That is, you can code intermediate ophthalmological service for this scenario. The second is review of interval history, external examination, ophthalmoscopy, biomicroscopy and tonometry in established patient with known catheter, not requiring comprehensive ophthalmological services. Even in this case also you can quote intermediate services. Now coming to the definition of comprehensive ophthalmological services. It describes a general evaluation of the complete visual system. These services describe general evaluation of the complete visual system. The comprehensive services constitute a single service entity but need not be performed at one session. They can take more than one session. Next is the service includes history, general medical observation, external ophthalmoscopic examinations, gross visual fields and basic sensory motor examination. It often includes, as indicated, biomicroscopy examination and cycloplegia or mydriasis and tonometry. They are included in the comprehensive ophthalmological services. It always includes initiation of diagnostic and treatment programs. Whenever a treatment program is initiated or whenever an acute complicated or any chronic complicated condition is diagnosed, usually generally requires a general evaluation of the complete visual system, and you can quote comprehensive ophthalmological services in that case. It includes initiation of diagnostic and treatment programs. Next is intermediate and comprehensive ophthalmological services constitute integral services in which medical decision making cannot be separated from the examining techniques used. They constitute integrated services in which medical decision making cannot be separated from the examining technique used. Itemization of service components. For example, slit lamp examination, catarametry, routine ophthalmoscopy, retinoscopy, tonometry or motor evaluation is not applicable. For example, comprehensive services required for diagnosis and treatment of a patient with symptoms indicating possible disease of the visual system, such as glaucoma or catheter or retinal disease. Or to rule out disease of the visual system, it can be either new or established patient. Coming to initiation of diagnostic and treatment programs. It includes the prescription of medication, arranging for special ophthalmological diagnostic or treatment services or consultations, laboratory procedures and radiological services. Whenever all these things are initiated, this is nothing but initiation of diagnostic and treatment program. Treatment program involves prescription of medication and arranging special treatment services. Whereas diagnostic include special ophthalmological diagnostic services, laboratory procedures and radiological services. Coming to special ophthalmological services, we have covered the CPTs that come under special ophthalmological services. Here we will just discuss what is the need or definition of special ophthalmological services. They describe it describes the special ophthalmological services describes services in which a special evaluation of a part of visual system is made. Describes services in which a special evaluation of a part of visual system is made, which goes beyond the services included under general ophthalmological services or in which special treatment is given. And whenever performed, special ophthalmological services may be reported in addition to the general ophthalmological services or E&M services along with 25 modifier. Let us see the examples of special ophthalmological services. Fluorescent angioscopy, qualitative visual field examination, refraction or extended color visual examination, for example, Nagel's anomaloscope. Nagel's anomaloscope should be separately reported. Prescription of lenses, whereas prescription of lenses when required is included in 92015. The prescription of lenses is also a special ophthalmological service which is included in the CPT 92015. It includes the specifications of lens types, monofocal, bifocal, others, lens power, axis, prism, absorptive factor, impact resistance and other factors. Interpretation and report by the physician or other qualified healthcare professional is an integral part of these special ophthalmological services where indicated, and technical procedures which may or may not be performed personally are often part of a service but should not be mistaken to constitute the service itself. Interpretation and report is an integral part of the special ophthalmological services. And next is technical procedures which may or may not be performed personally are often a part of the service. They are generally part of the service but should not be mistaken to constitute the service itself. Now let us see the CPTs for general ophthalmological services. They are categorized into two types, new patient and established patient. Coming to the new patient CPTs, the first one is 92002, which involves ophthalmological service, medical examination and evaluation with initiation of diagnostic and treatment program, intermediate new patient. The next is 92004. 92002 and 004, they include new patient. 002 is indicated for intermediate services. 92004 is indicated for ophthalmological services, medical examination and evaluation with initiation of diagnostic and treatment program, comprehensive. New patient, one or more visits. It requires one or more visits. Now coming to established patients, the CPTs for intermediate and comprehensive ophthalmological services for established patient are 92012 should be given for intermediate established patient, and 92014 is coded for comprehensive established patient, one or more visits. Now let us see an example. An established patient is diagnosed with iritis, which is an acute complicated injury, and an intermediate ophthalmological service were performed which included review of history, external examination and ophthalmoscopy. So here the patient is established and intermediate ophthalmological services were performed. So the appropriate CPT is 92012, ophthalmological service, medical examination and evaluation with initiation or continuation of diagnostic and treatment program, intermediate established patient. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.